Hi ma'am, I'm Chitra Arvind. I'm doing my second MBBS. I have a simple doubt. What are the different types of diabetes?
Well, primarily, in general, we have type 1 diabetes, type 2 diabetes, some specific types of diabetes and gestational diabetes. This is a broad classification. Type 1 usually affects children in the age group of it can present from 5 years, 3 years, 10 years of age group, and then up to early teens. And then type 2 diabetes, which is again which usually presents by the age of 35-40. Nowadays we are finding even teenagers getting type 2 diabetes, or maybe even children who are 12-13 years of age getting type 2 diabetes. And there are other specific types of diabetes, which is basically a secondary diabetes, which could be due to many other factors like drugs, or some syndromes like Down syndrome, a lot of syndromes which can cause diabetes. And then there is a category, a class called gestational diabetes, which happens only during pregnancy, and then it wanes away immediately after pregnancy. So these are the main type. Generally, we classify diabetes in this way.
Okay. You talked about the gestational diabetes, doctor.
Yeah.
Can you just explain a little more about gestational diabetes?
Gestational diabetes is something which usually presents in ladies who are pregnant, who are they get usually manifest by about 26 to 28 weeks of pregnancy, and we need to get in many patients we need to in all the pregnant ladies immediately at pregnancy or at diagnosis of pregnancy, we screen the patient with a simple oral glucose tolerance test, and once they are diagnosed to be having diabetes, we need to be more stringent in a pregnant lady with diabetes, because normally we say that in a non-pregnant lady, we say that fasting sugars of about 115 to 120 is okay, lifestyle modification is okay, and a postprandial of 160, 170 is okay, lifestyle modification is okay. But in a pregnant lady, we need to be more stringent, because we need to keep the fasting sugars below 100, and the postprandial should be somewhere below 140. Postprandial at any given time of the day, after any meal, or else there are a lot of chances that they might end up with complications of missed abortion or congenital malformations of the heart. They have other developmental anomalies. So being in gestational diabetes, the glycemic control part has to be extremely taken care of, and we need to be extremely stringent on that. The fasting sugars, no compromise, below 100, postprandial should be below 140, and also insulin is the drug of choice in pregnancy. So what we need to make the patient aware, many times it so happens the patient is always reluctant to accept that she has diabetes, and they are reluctant to take insulin. So once they have a feeling that once they start insulin, it is for life. In fact, that's a misconception, and it is only during pregnancy. So, usually once the pregnancy is over, the sugars drop to almost near normal stages, and post pregnancy, they 6 weeks after pregnancy, they need to be screened again with an oral glucose tolerance test, and they need to be advised regarding the lifestyle modification, diet and exercise post pregnancy. If they don't adhere to the normal regular routine lifestyle modification and exercise, there is every chance that they will get a full-blown diabetes. So they need to be extremely careful. And they need, again, for the second pregnancy, they have to be careful with the blood sugar levels, and before getting pregnant the second time, they need to get their HbA1c done levels first before conceiving, because if the HbA1c is an indicator how good your sugar levels are for the last 3 months. It's the glucose bound to the hemoglobin, so that gives you a fair amount of idea how good your glycemic status is. So every pregnant lady who has diabetes, who has once had gestational diabetes, before she conceives the next time, she needs to undergo a routine blood glucose levels to be checked, and an HbA1c and a counseling before they attempt a second pregnancy. So if the HbA1c levels are high and they conceive, we would usually suggest them to either terminate the pregnancy, because the A1c level before pregnancy, it needs to be maintained below 7 or at least 6.5 or below 7. If it is above 7, there is every chance that she might go in for an abortion, or maybe they may have some congenital anomaly. So that is the key. The glycemic control and HbA1c is the key. It has to, they have to be stressed on that before we discharge the patient.